to wash my hands really quickly. So I'm Kaitlyn. I'm going to be your MP for the day. How are you?
Good.
What brings you in today?
I seen a physical.
All right, so we're going to do a head, eyes, ears, nose, and throat exam. So just looking at her, she's a female. She has skin tone appropriate for ethnicity, so she's Caucasian. She has good body posture and structure, and she looks like she has really good nutrition, eats well, drinks well. And then we're going to move on to your first exam, okay? So first we're going to look at your skin and your nails. So just looking at her, she looks like she has good skin tone, and it looks like she doesn't have any pigmentation, but we're going to check that. So I'm just going to touch you. You let me know if you have any pain or anything, any tenderness. So as we go down, so her temperature throughout her body is warm. Her hands and her feet don't feel too cold, don't feel too hot. There's uniform skin throughout. The moisture, she feels moist, not too dry. The texture is smooth, and the let me look at your arm really quickly. I'm just gonna give a little move. Perfect. So no turgor there, so that's good. You're well hydrated. And then we're gonna look at your nails now. So looking at her hands, they look uniform. Her nails have a curved angle and a smooth consistency throughout. I don't see any bruises, abrasions, lesions, anything like that. Next, we're going to move on to your head and face exam, okay? So just looking at her, her head looks appropriate for her size, her body structure. It looks like it's uniform throughout. And I'm gonna touch you now, okay? So you let me know if you have any pain or tenderness. I'm gonna touch her scalp. Any tenderness so far? Okay, you just let me know. Move your hair back, sorry. So she has no pain, no tenderness, no edema throughout her head and skull and neck. And her hair is smooth. It has a smooth consistency, a smooth texture. There's no dryness anywhere, no lesions, no edema, and her hair looks like it's uniform throughout. There's no balding or presence of anything like that. We're going to look at your cranial nerves next. So I'm just going to take something soft, and I'm just going to sweep it over, and you just let me know if you have any pain, okay? So can you feel this?
Mm-hmm.
Okay. Okay, so I'm feeling her for her cranial nerves 7 and 5, and also I'm gonna have you smile really quickly, frown, puff out your cheeks. Perfect. So all her cranial nerves, all 7 and 5, are also intact. We're gonna move on to your eyes next. So, all right, we're gonna look at, just looking at you, your eyebrows and your eyelashes. They look full, they look well hydrated, so nothing's wrong there. And then we're going to have you open your eyes really wide, close them, squint them, perfect. So her cranial nerves 3 and 7 are intact. I'm going to pull down your eyes. All right, and let me know if you have any pain. So her sclera, looks white. Her cornea and her pupil and her iris all looked normal. Her conjunctiva looks pink, and there's no swelling, no tenderness, no drainage, along with her lacrimal duct. It's also a light pink color. There's no tenderness, draining, redness there. We're going to look at her eye movements now for cranial nerves 3, 4, and 6. So cover up one of your eyes for me, and I'm just going to have you follow my finger, okay? So up, here, down, perfect, here, up, and that's awesome. And then you can take this hand down. I'll let you get ready for a second. And then tell me when you can see my hands, okay?
No.
Perfect. So her prayer feels good. I'm going to have you follow my finger. We'll look for accommodation. Awesome. That looks great. So now we're going to look inside of your eye, okay? So I'm going to be looking. If this hurts you at all, please let me know, okay? Alright, turn my light on. Alrighty, so we're going to look, first I'm going to actually look at your pupil. So I'm going to check for your direct light. So I'm going to look at her left eye, and I'm going to shine the light directly on it. And when I do that, I should see her pupil constrict, which it does. I'll do it with the right eye too. Perfect, constriction. And now I'm going to check for consensual, which if I look at her left eye and come in, her right pupil should constrict. So we're going to watch that right now. Okay, let's do it one more time. Perfect. And let's check from this side. Alright, and it constricts. So awesome. So now we're going to look inside of her eye. So I'm just going to look inside of your eye really quickly. Alright. So I can see there's a normal artery to vein ratio. I can also see that the optic disc has a normal oval shape. The size looks consistent, and the color is like a light white color. I can see her AV crossing. I can also see her macula, fovea, centralis, and they all both have regular color. So we're also going to move on now. We're finished with our eye exam, okay? So we're going to look at your ears next. So I'm just going to move your hair, okay? Let me know if you also have any pain. So just looking at her ears, they fit her face really well. They have symmetry, good symmetry. The size looks normal for her head, and then it also has a good angle on there. They're protruding backwards. So I'm just going to look or palpate. Please let me know if you have any pain, okay? And I'm going to look around each ear just to look at the skin condition, make sure we don't have any thing that looks out of the normal. Any tenderness or pain? No. Okay, let's check this side. I'll check behind here. It's very important to check behind. So there's no painness, swelling, edema, redness around the ear. I'm going to palpate your pinna really quickly. Any turn or pain? Okay. The tragus, and then the mandible. Any pain? No. All right. I'm going to now look inside of your ear, okay? And please let me know if you have any pain with this. All right, so we're going to look. So when just looking at the first part of the ear, I can see that there is no cerumen present, there's no lesions, and there is no edema, and there's no presence of foreign body. Looking a little bit further in, I can see, are you doing okay? Mm-hmm. Okay, perfect. I can see the umbo, and that has like a reflective white color. It looks really healthy in there. The manubrium, the annulus, the pars flaccid, and the pars tensa also all look healthy. I can see all the bone structures in there. How's that? Any painness? No. Okay, so no painness, no swelling noted over there also. Now we're going to move on and look at your mouth, okay? Or your nose, sorry. We're going to go nose first. So when I'm just looking at her, I'm going to palpate the nostrils, and they have good patency. I'm going to turn my light on. I'm just going to look inside of your nose, okay? So just looking at it, let me look on each side. Let me look at this side. All right, so the septum has no deviations and no perforations. I'm going to look a little bit further up there, okay? Mm-hmm. So the mucosa is a light pink in color. I don't see any drainage. I don't see any swelling or lesions. The inferior and the middle turbinates are present, and I do not see any polyps in there. Now we're going to move on to the palpating. So I'm going to just palpate, and you just let me know if you have any tenderness or pain or swelling. So we're going to palpate the frontal and the maxillary sinuses. Any painness there? Okay. I'm going to now percuss. Let me know if you have any, and palpate. See if you have any pain there. Okay, so that all sounds normal and no pain and tenderness there. And the last thing we're going to look at is your mouth. So, just looking at her lips look smooth. They have a light pink color. She looks like she's well hydrated and getting enough oxygen. Can you smile for me? Perfect. All right, so open up your mouth for me a little bit. So we're just going to look first at her mucosa. Her buccal mucosa is light pink in color. Her gingiva looks light pink also and healthy. Her teeth are really white, so they look like she has good nutrition and she takes care of her body. We're going to open up, so stick out your tongue for me. Perfect. So cranial nerve 12 is working. If I look a little bit further back here, we can see she has no tonsils present. Her hard palate and her soft palate look smooth and also light pink color. I can see, say one more time for me. Perfect. So her uvula, it phonates when she phonates when she says something, and it elevates. So cranial nerves 9 and 10 are intact. And then I also see her pharynx back there, and it's a light pink color. Okay. So that concludes our head, ears, eyes, nose, and throat exam. Do you have any questions about today? All right, perfect.
Thank you.